Hello, good afternoon. Hello. Okay, excuse me. Hello! Welcome to the stream, Archetype. Crisostomo Ibarra. Hello. My voice is still a little bleh. My voice is still Ikemen right now. Like I said last announce, which I still have like my voice hasn't really fully recovered. So I am Ikemen right now. Hello Ventix, hello Mr. Grey Brown, and hello Pichu, hello. Hello iMac, hello Ann, hello Captain Jack Sanji. Okay, so hello Irene. Today, hold on. Today's Today we're gonna talk about not really just cancer, but like how do you know if a certain sign or symptom, if a patient or a person has a certain sign and symptom, if it's cancer or not. So I don't have any PowerPoint presentation for this because this is something that it's so broad. It's a very broad topic. Okay. Detecting cancer or finding signs and symptoms of cancer is very, very broad because there are different types of cancers. Because there's like cancer of, there's cancer of the skin, cancer of the brain, cancer of the bone, cancer of the fatty tissues, cancer of, pretty much everything, every part of your body has the potential to, develop cancer. So it's a very, very broad topic. So I have no presentation prepared for this. We're gonna do this as we go along. Ano Ikemen name mo, Doc? Ano? ShioriPon. Mr. Shiori. Mr. ShioriPon with a deep voice. Question, mapapagaling ba ng Alt-F4 ang cancer? Hindi. Malamang hindi. In your dreams, yes. As long as it's sealed and it's as long as it's a living unit of life or biological unit of life, then yes, it has the potential to become cancer. Yeah, it's not an easy topic. I was thinking about it. How was I supposed to go with this? Like, how was I supposed to do this? But yeah, it is almost impossible to really. I mean, it'll be a very long topic if I had a PowerPoint presentation. Lost my paternal and maternal grandfathers to cancer. I guess it runs in the family. Baka ako rin sa future. Man. Oh, that's... cancer does... It does... If someone in your family has cancer, it runs in the it can run in the family. Anyway, so... Alright, let's make this interactive, guys. Boys and girls. Let's see. Okay, let me... So yeah. Okay. Alright, I got my iPad ready. Okay, guys. So chat. I want to know... Alright, I'm gonna ask you, chat. What do you think... Wait, actually, before I go here, let's go back here. I'll just write it down as we go along. What do you guys, when you guys think of cancer, what comes into your mind? So I'm gonna write it down here, okay? What comes into your mind when you think of cancer? Let's change the color of this. Oh my god, please charger. What are you talking about? It's 52%. Pwede pa yan. Lots of money, lampabukol. No, without considering cost, okay? Without considering cost of whatever treatment for cancer. What comes into mind when you guys think of cancer? Lump or bukol? Okay, let me write. Okay, we're gonna switch it. Ano? Lump or bukol? Lamp, bukol. Okay. Lamp or bukol? I apologize for my handwriting, okay? My handwriting's terrible. It's gone malignant. Okay, malignant. What else? What else do you guys think of? When you Upaw? What's upaw? I don't know what is that? I don't know what that means. Upaw? Ano yun? Tumor. What's upaw? Kalbo. Okay, bald. Okay, baldness. I'm sorry, I don't know what that was the first time I came across that word, upaw. Is that a different language? Or a different, hindi, it's not Tagalog, is it? If it's not Tagalog, I wouldn't know. Tumors. Actually, tumors can be here. Tumors. Fast multiplication, bad. Parang you basically okay. Fast multiplication. Let me write it down. Multiplication of bad cells. It's not, well, to be, okay, what else? Bisaya. Upaw is Bisaya. Okay, I don't know. I'm not Bisaya, so I don't know. Chemotherapy. What else do you guys? Namamayat. Okay, namamayat. Decreasing weight. Okay. Namamayat, or like a decrease in weight, right? Decrease in weight. I'm sorry, this is like classic doctor's handwriting, especially when I'm writing fast. This is how it is. WBC gone rogue. Okay, so so this is what comes into your mind when you think of cancer, yes? Now, what do you think when you what makes you think, like, what symptom or sign makes you think that someone or maybe you have cancer? Like, what would Sign, symptom. What makes you think? What symptoms or signs make you think someone might have cancer? You can use Chat GPT if you guys want. And then we'll just go through each one of these, okay? Okay. Malnutrition. Pain. Payat. Okay. Thin. Coughing blood. Okay. Low immune system. You have to be a little more specific. Like, what do you think? What makes you think someone has low immune system? What is it that they're... What is their symptom that you think might make you think of low immune system? Nangihina. Weakness. Hello, SwitchCon. Hello. Dead skin cells. Dead skin cells. Always getting sick, okay. Frequent fever, so yeah, this would be like, this would be here. Frequent fever. Infection. Frail bones, okay. Okay. I think this is good enough. All right, guys. So let's use blue now. What the heck? Iba yung this one has thinner pen and the other one is thicker. Anyway, I think I used the wrong pen. All right. Okay. You see all of these symptoms that you guys said, like you see these symptoms you guys said, all of these are also symptoms of diseases that are not related to cancer. Like, for example, malnutrition. It could just be, malnutrition can be caused by a lot of things. It can just be the patient having a psychiatric problem that is not eating, so he's malnourished. Okay? It can just be that the patient is not eating properly at all. Kasi, poor siya. Poor siya, diba? Okay? Pain. Pain is also very broad. Because pain can be anywhere in the body. It can be a headache, it can be on the chest, it can be on the abdomen, it can be on a limb. And it can be caused by something other than cancer, right? Like, if you have a headache, it can be a migraine. It can be a stroke. It can be hypertension. It can be anything else. And also becoming thin, losing weight, it can also be because you're not eating enough. Because you don't, you're not, it can be psychiatric, right? Coughing blood. Okay, this one is a little more serious, but it can also be something that is not, caused by cancer. Like, a very common one, I know a lot of patients, or a lot of people would, consult me and say, Doc, inuubo ako ng dugo. And, when you say coughing up blood, it makes you think, oh my god, what does that, it must be something serious, right? But then when they say, inubo ako ng dugo, muubo ako ng dugo, sometimes it's just a little streak of blood. Like, it's just yung parang laway or yung plema, tapos it's just a little streak of blood. So coughing up blood, if it's like that, it could just be an irritation because of you've been coughing too much because of a cold or because of a respiratory disease. Oh, ala. Yeah. Nag-lock yung screen ko. Could be a respiratory disease. And then, Tapos, it can also, because of irritation from coughing too much. It can be TB, which is a little more serious. Okay, and TB, tuberculosis, is a very, what do you call this? It mimics cancer, actually. TB is a very good at mimicking cancer. Because you might think you have cancer, yung pala TB lang pala. Even though TB is not something tuberculosis is not something you brush off. TB is kind of serious, but, it's not cancer. What else? Weakness. Weakness can also be from not eating enough. It can be from, being tired. It can be from having a fever. It can be a lot of things. Tapos whoever said dead skin cells, I don't know what you mean by dead skin cells. But if we're gonna say like skin that like, the dry, yung parang dry skin or flaking, it can be caused by things other than cancer, like psoriasis or dermatitis, when your skin is just flaking. Always getting sick, it can be something other than cancer. It can be what do you call this? Someone mentioned HIV. That one, because HIV means you are immunocompromised. So if you're immunocompromised, you're also getting sick. It can be caused by that. But cancer can make you immunocompromised also. See? Frail bones is another one. It can be because you have osteoporosis, when your bones are becoming weak because you're old, right? So it's really, that's why I said it's actually really hard to say, how do you know if someone has cancer? It's not, the thing with this topic, it's not straightforward, because every symptom you can name can be something that is not cancer. So how do doctors diagnose cancer, or why do we suspect cancer? It's actually, it's hard to detect cancer. It's not as easy. It's not easy like 1, 2, 3. Like if you have this and this and this, if you have these symptoms, if you have pain, if you're thin, if you're coughing blood, oh, you have cancer. It's not like that. It's not like that. It's not as easy as that. It's a lot more complicated. That's why I can't just do a PowerPoint presentation, because that's gonna take like what? More than the usual slides I do. MRI, CT scan, but yes. See, this is the thing. Let's say it's not just the MRI and CT scan. How do doctors at least not really diagnose cancer, but how do they suspect someone has cancer? Okay. Yeah, I think that's one of the things. Does a doctor or a medical practitioner suspect that someone probably has cancer? Right? There are many ways. Okay, so let's say so it's like all of this, what you said here, what comes into your mind when you think of cancer, all of these actually are true. Okay, somewhat true. Okay, the lump, if there is a lump or a bukol or a tumor, every time there is something like that in a certain organ, not just anywhere, like let's say the breast. If there is a lump on the breast, almost always a doctor will have cancer at the back of his or her mind. Okay? If it's a lump or a bukol or a mass, a tumor in the intestine, the large intestine, almost always also the doctor will think at the back of his or her mind, it must be cancer. Okay? They do biopsy first. Yes. Okay. But if you say, may bukol sa balat, let's say you have a tumor or a lump on your on your, let's say, on your shoulder. Like a small 1 centimeter lump on your shoulder. And it looks like it's at skin level. Okay? A doctor will most likely not think it's cancer. They'll think it's something else. Okay? See, the thing with cancer is that we take into account a lot of things before we consider it. Before we start thinking it might be cancer. We take into consideration the age of the patient. Okay? And age is very important. Let's go down. Let's go down here. Let's go down. Age is very important, okay? So, blue. This is blue. Age. So, usually, for cancer, age is usually in the elderly. Okay, elderly. So, the older you are, the more we might think of cancer. Okay, the older you are, the more we might think of cancer. Like, let's say, for example, we're gonna talk about the breast, okay? A 20-year-old that has a 2-centimeter breast tumor versus a 60-year-old woman who has a 2-centimeter breast tumor, okay? We would think more that the old lady, the 60-year-old has cancer rather than the 20-year-old. Okay? Because most likely the 20-year-old that has a tumor on her breast, it is most likely just benign or non-cancerous. But if it's an old lady, we're gonna think, we gotta watch out for this old lady, she probably has cancer. Okay? So that's why biopsy is important. Biopsy is one of the surefire ways to diagnose cancer. Okay. So placement is really important. Placement, what do you mean by location of the tumor? Yes, in a way. In a way. It's not always true. See, there's a thing. I can't say 100% yes. I can't say 100% it's no. It really depends. It really depends. Especially if it's a skin tumor or a skin lesion. Those things can get tricky. Okay, but anyway, yeah, so one of them is age. Okay, if the older you are, the more we would think about cancer. The younger you are, not so much. Okay? What the heck, Mayo Twister? What is this? My ureteral stent came out today and I'm in so much pain. Bruh. Anyway, so what else? Okay, next is, aside from age, okay, location. Let's go to location. Yo, my pen died. Wait. Okay, there we go. Location of the tumor. So yes, it depends. Okay? If we're gonna talk about breast, tumor in the breast, if you think of a mass or a lump on the breast, and if we're gonna compare, every time we talk about lump or tumor on the breast, you always have to have at the back of your mind cancer. But if you're gonna talk about a tumor on the breast of a 20-year-old versus a 60-year-old, if you're gonna compare the two, you would have you would be like 50-50 that the old lady probably has cancer. Compared to the 20-year-old, you'd be like 20% of the time this one is not this one is cancer, 20% of the time compared to the old lady. But when it comes to the breast, you have to have a biopsy. You have to rule out cancer. So when a patient comes up saying, "May bukol ako sa suso," or "I have a mass, I feel something hard on my breast," a doctor has to really explore that. And you have to rule out cancer. Okay? And then, What other location? Skin? Skin is a little tricky. Okay. Let's say skin. Skin is tricky, but most of the time, majority of the time, if a patient comes in with a lump in somewhere like in the arm or some area like a leg, the back, the chest, most of the time it's benign. Most of the time. Okay, there are times where it is not really benign, especially when it's large. Okay, this is why it's just easy to just have this thing removed. Okay. What else? Lungs. If you have a tumor in the lungs, that has to be explored also. It can be cancer, it can be TB, because tuberculosis can really mimic cancer. Okay, Discord notice. Sorry, I'm not streaming a game, that's why you can hear the Discord notice. Bruh. You want me to, wait lang. Sige, wait. God. Okay, I'm gonna turn off Discord. You guys are getting... I'll put it on Do Not Disturb, bro. Bigla na may lalabas. Okay. What could a lump be if it's benign? It could be anything. It can be a cyst. It could be depending on the location. It can be a lipoma. If it's a lump on the fatty tissue, it's a lipoma. Sorry. Sorry about the Discord notice. Okay. If it's in the intestines, you have to, this one you really have to consider, you have to rule out cancer. Okay, intestines. That's why you have a colonoscopy and a, gastroscopy and endoscopy. So, aside from location, there's also size. Oh no, size. Size. Usually, the larger it is, the more chances of it being cancer, okay? Larger, most probably cancer. Okay? The larger a tumor is, the chances of it being cancer is bigger. Okay? And also, we take into account the speed of its growth. So, if it's a tumor, speed of growth. The faster it grows, probably cancer, okay? But if it's really slow, it's probably not cancer. There are some exceptions to this, of course. There are some exceptions. There is a tumor on the breast that grows really fast. Like, it's like 2 cm when they consult. And then after like 2 months, it grows into 4 centimeters. There are some that are, or it can grow to like 5 centimeters from 2. There are cases where the tumor grows, but it's not cancer. It's actually benign. It's just like really, it grows really big. Okay? So basically, it's not, now you see how it's not that simple. Okay? It's not that simple. This is why doctors go to training for years before we can even, before we become doctors, become licensed. We have to know all this. That's why this is something that you can't just you can't just use Google. Okay? Without any background of how to diagnose cancer. It's not that easy. Google or ChatGPT can give you signs and symptoms, but those signs and symptoms can be other diseases. Okay? This is why, one of the first things that when you when you talk to a patient, when we talk to a patient, the most important thing we ask is the history of their present illness. The chief complaint, why did they arrive? Why did they come to see the doctor? When did it start? Like, we ask them, okay, for example, breast. I have a mass on my breast. 22-year-old girl comes into the clinic complaining of a breast tumor on her left breast. We would ask, okay, when did you notice this? How long has it been? Did you notice, did it grow? Did you notice it growing? Did you notice it grow bigger from the last time? Is there any discharge coming from the nipple? Do you have any other symptoms aside from this mass? Do you have other illnesses? Do you have a family history of breast cancer? We have to ask everything. So it's really a background check. And aside from that, you have to do a physical examination. You can't just rely on history. We have to do a physical examination. So if we palpate the breast or the tumor, and based on what we feel, we can pretty much tell by just feeling if it's cancerous or if it's not suspicious for cancer. Because if a tumor on the breast is movable, if it's hard, movable, and the borders are smooth, like when you feel it, it's just like a golf ball in the breast and it's movable, and then her armpit doesn't have any enlarged lymph nodes, it's most likely not cancer. But if the patient's tumor has not again. Wait. But if the patient's tumor is not is rough around the edges, it's not smooth, and then it's not as mobile, then and you start feeling lymph nodes on the armpit, then most likely it is cancer. See, it is not that easy. Okay? So let me see. This is sabi nung AI summary, may cancer na daw ako. Yeah, that's the thing, right? You can type in Google or ChatGPT, I have a headache, what is my diagnosis? And it's gonna tell you have cancer. You have a tumor in your brain. You're gonna die in 6 days or something. I don't know. Doc, pag pumasa kayo, licensed na kayo. Bro, I am already a licensed. What are you talking about? Okay, wait. We gotta clarify this because this is not... I'm gonna clarify this, okay? I am already licensed. I have my PRC license. Okay, I am a doctor and I can practice. I am licensed. My exam is a diplomate exam. Okay, I think some people have been saying this to me, like, oh, you're going to get your license. I'm like, no, I have been licensed for years already. I've been licensed for years. Okay. I am not, I am already a licensed MD, and I just finished residency just recently, last year. And then what I am taking is a diplomate exam. Okay? Diplomate. I am able to practice surgery. Diplomate exams just make it more prestigious. Okay? They got too into your rogue lore. Yeah. Maybe you can say I'm not licensed as a VTuber, but not in real life. Okay. Alright, anyway, continuing on. I hope you guys get what I'm saying, that diagnosing cancer isn't that easy. We're gonna go through each system, okay? So, let's see. The easier ones for me, if we're gonna talk about the brain is a little tough for me because I'm not a neurosurgeon. But brain tumors, brain tumors are a little tough. As far as I know, as long as you have a brain tumor, whether it is benign or not, it has to be removed. So, the earlier the better. The earlier the better. And I think as long as the brain tumor is removed, whether or not it's cancer, that is fine. That is okay. The management doesn't change. Because whether it is benign or malignant, a brain tumor that is cancer or not, you have to have it removed. So we can skip through that. Okay? We can skip that. Let's talk about the thyroid. Thyroid is a gland on your neck, okay? And that one is also susceptible to having bukol or lumps. So there's two kinds, benign and malignant, right? There is such a thing as goiter. Goiter, when you say goiter, this is very common, goiter, right? When they have a neck enlargement. Goiter is benign, actually. We call it multinodular colloid non-toxic goiter or multinodular colloid goiter. That is benign. No matter how big that shit grows, it is benign. But of course, sometimes a goiter can have like small cancer cells. They call it like micropapillary cancer, something like that. But see, the treatment is also the same. You have to remove the thyroid, so it gets treated. But depending on the size of the cancerous portion of the thyroid, that's when you have to go through radiotherapy and all that. I think Ratanak is a perfect example. If you guys know Ratanak, he recently I had a stream about thyroid cancer and it featured Ratanak. He's a Cambodian VTuber. He was diagnosed with thyroid cancer and he had a surgery for it. A major surgery, by the way. But anyway, so what are the symptoms of goiter? So if you have a goiter, one of the first things you notice is a lump on the neck. Yeah? A lump on the neck, bukol sa leeg, sometimes hoarseness, because sometimes the bukol or the thyroid is so big that it's impinging on the nerve for your on the neck that helps you speak. Okay, and then there's also the type of goiter where it's so large that you can't breathe properly or can't swallow because it's so big that it's impinging on your trachea or your esophagus. Okay. What else? Recurrent laryngeal. Yes, the recurrent laryngeal nerve there. That was at the tip of my tongue. If they remove the thyroid, how will the endocrine function? Well, they have to be on meds. That is their maintenance medication. What else? Sometimes there's also cough because of the irritation. So you see the symptoms that I'm mentioning, they can be for both benign or malignant. The only way that you can 100% diagnose someone or be sure that someone has cancer is through a biopsy, where you take a sample or they remove the tumor itself. But what will make us suspect that it's cancer more is the age of the patient. So when it comes to thyroid, you have to let's say you know someone who has a mass on their neck. How do you know that they have cancer? One is their age. Are they older than 55? Sometimes younger people can have cancer, but most of the time, it afflicts those who are older. Do they have hoarseness? Because sometimes hoarseness is a sign that the tumor invaded or is irritating the recurrent laryngeal nerve, the nerve in the neck. Sometimes it's more associated with cancer. Another one, how fast did that mass grow? How fast was it growing? Did it grow within the year from like 4 centimeters to like 8? Did it grow that fast? So if the faster it grows, it's probably cancer. Right? That's what I said over here. See? Age. Oops. Location, it depends. Size, is it large? Is it very big? You have to consider cancer. How fast did it grow? So if it's very fast, it's probably cancer. Okay? What else? Yeah, basically that. Oh, and also some other symptoms also, like general symptoms that can be associated with cancer is, someone said it, the weight loss or malnutrition. So you can consider tumor of the neck. How old they are? Are they older? They're older than 55. Is it very large? Is it growing fast? Are they losing weight just as fast? Like from January this year, did they lose 10 kilos in a month? Fast weight loss. Yeah? They have loss of appetite. Then we can consider cancer. Okay? Cachexia, yes. Cachexia is like a physical, like they're absolutely thin. They're like really thin. That's like late stage, man. Cachexia is like, they're like skeleton thin. So, see? You have to think about that. It's not just, oh, he has a lump on his neck. He has a lump on his neck, then it's cancer. No. Oh, hi, Rat. Yeah, we were talking about you as an example. Ratanak is a very good example of a person who had cancer but is not old. That's why I say cancer can affect elderly more, but it can also affect younger people. And Ratanak is a perfect example. Yeah. Oh, and another thing, if they have enlarged lymph nodes, so aside from like a lump on the neck, on the thyroid, if you feel other lumps, small lumps around the neck, those are probably enlarged lymph nodes. Most probably it's cancer also. So when you diagnose cancer, it's not just 1, 2, 3 symptoms. It's looking at the patient as a whole to be able to diagnose cancer. Looking at the patient as a whole from their chief complaint, their history of present illness, their physical examination, their age, how big where the tumor is, how big it is, does it have any other associated symptoms? It's like a whole. Maybe his body's old, bro. Wait, isn't enlarged lymph node because of getting sick? Well, technically when you have cancer, you are sick, right? That's why I said it's not easy to just diagnose cancer. See, if you have enlarged lymph nodes, it can also mean that you have an infection, right? So that's what makes diagnosing cancer a lot more complicated than it really is. You really need training to do this. Like, you can have lymph nodes on the neck but not have cancer. But, see, if you have a lump on your neck, and it's confirmed to be the thyroid, plus enlarged lymph nodes, then yes, you can think about cancer. Because if you have a lump associated with enlarged lymph nodes, is usually something usually something cancerous. But if you have like multiple if you have an enlarged lymph node on your neck, it can be anything. It can be a random infection like a cold, it can be tuberculosis, or it can be something else. Oh, God, not again. Bruh. Can lymph nodes stay enlarged for a long time for any other reason than cancer? Tuberculosis is a perfect example. And tuberculosis is very common in the Philippines. Ventic, seems like a headache to diagnose since symptoms overlap. Yes, it is. It is. That's why cancer, that's why it's not that easy to diagnose cancer unless you have tissue diagnosis or tissue biopsy and imaging like CT scan. CT scan is the most common one. MRI for like other organs. I think brain. But I think CT scan can also detect that. MRI also for like limbs, their arms and legs. If you're gonna think of sarcomas or soft tissue tumors in the limbs, MRI is the best one. Okay. I had a patient last week with brain cancer at 8 months. Holy shit. Medulloblastoma. Okay. Yeah, those type of... There are cancers that affect babies, but those are like rare. Rarer than the usuals we see, and those are very unfortunate. Those types of cancers I don't handle. CT scan and MRI, the aka the magic diagnosis donuts. Yes, they are. Okay. So, okay, we're done with thyroid. Okay. We'll go to, what's it called? Breast. Okay, breast. The thing with breast, it's almost the same as with the thyroid. If you have a lump on your breast, you have to have it checked. It's also it follows the same thing. The older the patient is, the more you would consider cancer. The larger the tumor is, the more you would consider cancer. The faster it grows, the more you would consider cancer. Except for one type of breast tumor, which we call it the phyllodes tumor. That shit is benign, most of the time benign, and it grows rapidly. It behaves like cancer, but it's not cancer. There's also lymph nodes. The lymph nodes of breast tumors are actually you would see them in the armpits or under your clavicle. The clavicle bone is your collarbone. So if you feel like below your neck you have like two bones on the right and the left, that's your clavicle. If you feel lymph nodes underneath that or lymph nodes on your armpit, plus a tumor in your breast, then yes, you can consider cancer. Okay. Speaking of MRI scanners are now scared because of final. Oh god, yeah, I watched that. I actually watched that. I have no idea how strong MRIs can be because I am not a radiologist or a rad tech, and I never really actually studied MRI. I just know that, hey, MRI, okay, magnets. MRI, alright, magnets, non-radiation, let's go. Yo, you're not supposed to have metal on you when you go to MRI. Does this apply to man also? Yes, men have breasts, therefore, yes, you can have cancer of the breasts. Okay? This stream is so timely. I'm waiting for my blood smear results. Already did fecal blood test, CBC, ferritin, abdominal ultrasound. Google AI low-key puts cancer. Oh, yeah, the blood smear? You're gonna have to wait for that one. I think that will determine what you have. But yes, like I said, diagnosing cancer, that I've been saying, diagnosing cancer is not simple. It's not simple as having these symptoms. You need to have tests. That's why when we suspect someone has cancer, given the signs and symptoms, we have to order tests. Blood tests. Sometimes we do imaging, especially. That's very important, especially in surgery. Imaging. CT scans are our best friends. Can a cancerous thyroid make it hyperactive? Oh, this one. Okay, wait. A hyperactive thyroid. If you have a hyperactive thyroid, there is an additional test for this. This is where you have the hot and cold. I think this is called the radionuclide scan. The more hot your thyroid is in the scan, the less likely it's cancer. But the colder it is, then you have to do a biopsy, something like that. The hospital I worked at didn't have that kind of scan, so I wasn't really able to see how it really works in actuality. But yeah. Usually a thyroid that is hyperactive, there would be a lump there, but it would still need a biopsy. So it's like a 50-50 thing. How rare is breast cancer in males? Very rare. Very rare. But it's still possible. Okay. So I think that's what we're done with breast. Lungs. Okay, someone mentioned a while ago about lung cancer. Lung tumors are a bit more kind of complicated, but either way, as soon as you notice someone has on CT scan that there's a tumor in the lung, you have to have that biopsy. Okay? Now for like lung cancer can have almost the same symptoms as any other pulmonary disease. Cough, difficulty breathing, coughing up blood. You know, that's actually almost the same as pneumonia and tuberculosis. You see? It's really if a patient has cough, difficulty breathing, coughing up blood, we go back to the same thing I wrote down a while ago. Wala, ayaw na. Oh, wait, what? What happened here? My iPad is not lighting up anymore. Is it showing here? Ayaw na magpakita. Oh, hold on. Anyway, as I was saying, a patient that has cough, colds, or difficulty breathing, right? Coughing up blood. Same thing. How old is the patient? Is it an elderly? Okay, you can probably think that. Possibly cancer. Location, well, lung. Okay. Size. How big is the tumor? This one you can see in CT scans or chest x-rays. How fast did this tumor grow? Because if there is a change in size and it's fast, it's usually cancerous, right? Now, another thing is, how long did it take, or how long have you had the symptoms? Did you have the coughing of blood just suddenly? Was it within a few weeks? Did you have this cough only last week and then you started coughing up blood you never have cough before, then you wouldn't consider cancer. Because cancer is something that grows, right? Because what you have, if you cough up blood, it can be just, like I said a while ago, it might just be streaks of blood from coughing so much that you irritate your throat, and then, because of the irritation, you're coughing out blood. It's a different story, though, if you cough out, like, fresh blood, like no phlegm at all, it's just all blood, then, yeah, that is a different story. There is bleeding going on inside your lung. Okay. Nahawa ba o naiimamana yung cancer? Nahawa, no. It's not, you don't, cancer is not, transmissible like COVID or HIV. Hereditary, yes. If it runs in your family, you might get it eventually. Like breast cancer is very strong in the family. Like if someone in your relative has breast cancer, you gotta watch out. Because maybe you might get it. And yes, it's also in the gene. There are specific genes for breast cancer that if you have the genes for it, then you will probably get breast cancer like earlier on in your life. Radiation, yes, like a thyroid, that's very common. Thyroid cancer, radiation, yeah. How do you do biopsy of the lungs? They have this thing called CT guided biopsy. I think that one is possible. The radiologists can do that. They use the CT scan to like guide the needle where they need to biopsy. Sometimes we can do an open biopsy, which is through thoracotomy, but then usually if we do that, you just remove the entire tumor. I have a family history of cancer and diabetes, so the diabetes stream was informative. Oh, okay, that's good. I'm glad you found it very informative. Okay. All right. What else? Okay, so that's for lungs. What else is common? Okay. Intestines. Same thing. Usual symptoms for those who have cancer in the intestines, especially the large intestines. Okay, I don't think it was written here in the what you guys wrote, but okay, we're gonna write it down. We're gonna talk about cancer of the large intestines, okay? So, symptoms of cancers in the large intestine: constipation. Sometimes even diarrhea. Right? Sometimes, abdominal pain. Abdominal pain. Sometimes, bloody stools. Or we call it hematochezia. We call this hematochezia. There's also black tarry stools, which we call this melena. Abdominal distension. Hello, Updog. Hello. Vomiting. Okay. See, all of this are very... If you look at all of this by themselves, they can be caused by different diseases as well. Constipation, you just have hard stools, you're not drinking enough water. Diarrhea, it can be caused by bacterial infection. Abdominal pain can be caused by anything. It can be like appendicitis. It can be like just bloatedness. It can be anything. Bloody stools can actually be caused by hemorrhoids. And hemorrhoids is not cancerous. Black tarry stools, this can be caused by bleeding that can also not be cancer. Abdominal distension usually this is caused by obstruction in your intestines, which also can be not cancer. It can be something else. Vomiting is also the same. Something is blocking the way. Constipation drains you from dehydration. Yes. Okay. Abdominal distension means when your abdomen is enlarged or distended. Your abdomen gets parang lumobo. It gets larger, like a balloon. Like you feel bloated. You can't poop at all because of obstruction, and your abdomen gets bigger because you can't defecate. That's abdominal distension. Using the emojis para sulit ang membership. Don't worry, I'm gonna have a membership stream soon. Okay. So these are symptoms of other diseases, but can also be symptoms of cancer. So what would make us think that a certain person has cancer? Of the intestine, of the large intestine. We go back again. Age. But this time, when it comes to colon cancer, it can be younger than elderly. They can go as early as 40s. Okay? Especially if this runs in the family. They can go as young as 40s. Location, intestines. Size. The larger the tumor in the intestine is, the more likely you're going to have abdominal distension and vomiting and also constipation. Okay? And abdominal pain. Speed of growth, the same thing. Okay. 40s, that ain't young. That 40s is actually considered young in the medical field. Especially when we're considering diseases. Okay? Because 40 is actually not that old. When we say elderly, that's like 60 above. Probably even older. Sometimes even older than 70. Is the colon cancer? Yeah, colon is the other term for large intestine. Okay? Colon is the large intestine. So, yeah. So when we have a patient that comes in, let's say we have a patient, 45-year-old male, coming in, say his complaint is it's hard to poop. I'm having a hard time pooping. Yeah. I'm having a hard time pooping. Constipation. We ask him. We have to go through that thing. Okay. How long have you had this? Oh, I had it for like past 6 months now. Okay. Did you notice any changes in the size of your stools? And then yeah, they're like pencils, or it's like goat poop. You know how goat poop is like, they look like balls, little tiny balls. They look like little balls. Do you have did you have, when you pooped, was there any episode of having blood in your poop? And then he would say yes. When he says yes to this, having an episode of bloody stools, that would start the bell. That would start ringing our bells. And then on physical examination, you could ask him, did you notice that your abdomen is getting bigger? And he would say yes. Then we would start thinking, he probably has obstruction. He's vomiting, probably has obstruction. Yeah. Another one, you would ask, was there weight loss for the past few months? Like, really really quick, rapid weight loss. If they say yes, then we start thinking about a cancerous lesion. And these types of people need a biopsy. When we start thinking, okay, cancer, you gotta get a biopsy. I'm in my mid-30s and apparently it has early onset hypertension. Nothing like talking to doctors to make you feel young again. Hey, hypertension in your 30s? I know some people who have hypertension they started in their 20s. It's a thing. It's most likely hereditary. Or a bad lifestyle. Lost my paternal grandfather to colon cancer. When we visited him in the hospital, that was the first time I found out about adult diapers. Yeah, adult diapers is for those who can't, they can't go to the toilet by themselves. They can only stay on the bed, so they need diapers. Okay, I gotta drink. Okay. So again, diagnosing cancer is not simple. You have to look at the patient as a whole. Or at least, suspecting cancer, you have to look at the patient as a whole. And then you would have to do colonoscopy. For colon cancers or large intestine cancers, you have to do a colonoscopy for a biopsy. CT scan also. CT scans will be able to show us if there's a tumor in the intestine. And then a tissue biopsy can confirm. But there is also such a thing as GITB or gastrointestinal tuberculosis. And it can mimic cancer. I've had a patient who had weight loss. See, the thing with TB, the thing with tuberculosis, you can also have weight loss. It really looks like cancer. Like, I had a patient, an old man, okay, well, slightly older, he's like 60s. He had rapid weight loss, okay? And then when they took they had an X-ray, and he had like lesions in his lungs, okay? He complained of, if I remember correctly, black tarry stools, or difficulty pooping, and abdominal distension, so he was referred to surgery. So at that time, we were thinking of, this guy probably has cancer. But eventually he was able to poop, so we were like, okay, we're gonna go through the proper diagnostics. So we had a CT scan done and a colonoscopy. The CT scan showed a tumor on his ileocecal area, which is the area of the cecum, the first part of the large intestine or the colon, and the end of the small intestine. So at the point where the small intestine and the large intestine meet, he had like a tumor there. Oh God, not again. Okay, he had an intestine there. And then he had a chest x-ray of lung lesions. And then also he had a chest CT scan, which said that he had lesions. He had like lumps or tumors in his lungs. On the upper part of his lungs, okay? On the upper portion of his lungs. And we're like, yo, whoa, is this guy probably at stage? We were thinking, oh no, it's a cancer with metastasis to the lungs. It's probably stage 4 colon cancer. Yeah. So they did a biopsy, and we were gonna, like, you know, we waited for it because he was actually eating well now. He was feeling better. When the biopsy came out, it was tuberculosis. We were like, what the fuck? We're like, what? It's not cancer, it's tuberculosis. I told the patient, you know what, you're lucky, man. This is tuberculosis. All you gotta do is take 6 months medical treatment, and it should go away. Bro was lucky. He's lucky. Yeah, apparently he had gastrointestinal tuberculosis. He had TB of the lungs, and then it also presented as gastrointestinal tuberculosis. So his illness was actually all TB. He had weight loss because of the TB. He had a tumor there because he had a quote-unquote tumor in his intestines because of TB. All that was caused by tuberculosis. He was sent home afterwards. He was feeling a lot better, actually, afterwards. He was starting to eat properly, and he was on meds. He was feeling better, actually, after that. GITB is a thing. Yes, it is. TB can go... Like I said, TB, tuberculosis, is a great mimic. It can mimic cancer. There is TB of the joints. Okay? There is TB of the joints. You can have TB almost anywhere. It's the same. It's just that it's not as common because, well, here in the Philippines, probably it's more common than in other areas of the world, like let's say America. America doesn't have TB, or very rarely has TB. Like if you mention tuberculosis there, they're gonna look at you like, oh, that's so rare. But then when you come to the Philippines, it's like everywhere, man. Everybody and their mother has tuberculosis. Pott's disease, yeah, TB of the spine. I've had patients with that too. Very debilitating. Rich kid kasi you. They eradicated TB there. Okay. So yeah. Okay, what else? Someone mentioned prostate. Prostate cancer. Okay. We'll go with prostate cancer. Prostate cancer is a little tricky. Because prostate cancer is you can only diagnose that by biopsy, which is usually done anyway for anyone with enlarged prostate. Okay. Wonder why TB takes so long to treat nowadays. I thought it can be started to become faster treatment. Because it's a special type of bacteria. It's not just any bacteria, it's a mycobacteria. Those little shits are annoying. They're like bacteria with freaking steroids, that's why. They're bacteria but mycobacteria. Okay. Alright, so with prostate, prostate cancers have the same symptoms as BPH or BPE, benign prostatic enlargement or benign prostatic hyperplasia, which is a very common thing in older men. So if all of you, for those of you, maybe majority of you are men, right? The older you get, I'm sorry, you guys are gonna have enlarged prostates. There's nothing you can do about it. It is something you are destined to have, enlarged prostates. And when you have enlarged prostates, what happens is you're gonna have difficulty urinating. Sometimes you need to pee. You go to the toilet, nahihirapan ka. You can't pee right away because your prostate is too big. It's blocking your urethra. And when you are able to pee, the stream of your pee is too weak. And then by the time you're done peeing, you feel like you still have pee inside your bladder, but you can't pee it out anymore. Sometimes it can be, you needing to pee, and before you could reach the toilet, your pee comes out already, or your pee is like dribbling. You're dripping pee already. So, that's a thing. As long as your prostate gets enlarged, large enough, it'll block your urethra and you're gonna have symptoms of that. Now, if we're gonna talk about the treatment of BPH or benign prostatic hyperplasia is medical, but sometimes when it's too big that it's really affecting how you pee, if it's very severe, you have to undergo a procedure, which is they call it a cystoscopy transurethral prostatectomy, where they get shavings of your prostates through a camera. It's called a C-TURP. Anyway, they get shavings of your prostate and then clear up your urethra. And the shavings of your prostate are sent to biopsy. So that is one way to know if you have prostate cancer. There's also transrectal prostatic biopsy, where there is, a certain part of your prostate that needs to be biopsied. And they have to do it through the rectum. You're gonna have an ultrasound in your butt, and then they put a needle through there. And that's how they get a biopsy of your prostate. Okay? Totoo daw, Doc, kapag umihi daw ng lalaki, ang lalaki sa pregnancy test, sunod kapag lumabas na possible daw na testicular cancer. Oh, yeah, yes. Yes, actually. That's actually true. I forget which cancer that one was. There's different types of testicular cancers. But I've had a patient with that. I think it was a seminoma. We had to remove the testicle, the testes. Okay. Why does the prostate enlarge in elderly males? Actually, there is no clear reason for it. I think there's no actually clear, as far as I know. I think it's more of like hormonal changes. And it's also an aging thing. Like the older you get, the larger it just becomes. I'm not really sure actually of the pathophysiology of it. But it's something that you get as a man when you grow older. No, it's not diabetes. No, it's not. You can have enlarged prostate and have no diabetes. Age related, yes. Imagine being 100 plus. Well, you see, the thing is, when you are already having signs of enlarged prostate, you're already gonna start taking maintenance medication for it to control it. So you can be 100 plus and have a normal sized prostate because you are on meds. Or, you can control it. Alright. So what else? Yeah, I guess that's majority of it. So basically, if you want to diagnose cancer, or if you want to consider something, a symptom as something probably leading to cancer, remember that it is not simple. Remember what I talked about, like the age related. Yeah, usually the older you are, the most likely it'll be cancerous, but it can also happen to younger people. How long? Where is the location of the tumor? If it's a tumor, if it's a lump, how long has it been? How long did it take for it to grow? Or what is the size of it now? But it's not just limited to that. You have to take into consideration the patient as a whole. So it's like the age, the gender, even gender plays a role on some specific cancers. Like breast cancer. If a man has a lump on his breast, one of the things you would immediately have to rule out is breast cancer. Whereas if a woman has it, it's more like, oh, we just do this. It can be non-cancer. It can be non-cancer. It can be benign or or malignant. Doc, ang cancer ba ay imminent? Sooner or later, magkakaroon karamihan ng tao kahit healthy living. You can't say. I can't say. It really it depends on several factors. A person can be cancer-free throughout his entire life, but a person can also develop cancer later on in life. It depends on several factors. It can depend on genes. It can depend on your lifestyle. Okay? It can depend on your lifestyle, the environment. Because some cancers are also, aside from genes, it can come from the environment or your lifestyle. Like, lung cancer. For example, lung cancer or nasopharyngeal cancer of the throat, basically. Most commonly associated changeable lifestyle, modifiable lifestyle is smoking. Do you smoke a lot? If you smoke a lot, eventually somewhere down the line, you will have cancer. It doesn't need to be in the lungs. It can be on the throat. It can also be in the gastric or the stomach. Stomach cancer is also associated with smoking. So, see, as doctors, we also have to consider that. If we're thinking cancer of the stomach, of the throat, of the lungs, we will also ask about their smoking history. Yeah, smoking kills. A lot of people think smoking lung cancer. And then they'll say, I'm a smoker. I smoke 20 packs a day for the past 30 years, bro, and I don't have lung cancer. Like, yeah, you don't have lung cancer now, but have you checked your stomach or your throat? Or somewhere else? The esophagus? Yo. And even if you haven't had cancer, had cancer yet, that doesn't mean it's gonna happen. It's not gonna happen. Is there a cancer for like every body part? Yes, even the appendix can have cancer. Secondary smoking. Yes, secondary smoking is included. Even vaping now kills. Yeah, vaping does. Vaping was never safe in the first place. It's just almost the same. $20 packs. Yeah, you never know. People can smoke. There are chain smokers, man. You never know how many packs a day these people smoke, man. Like, they live and breathe the smoke. They live and breathe tobacco. It's not like cancer's the old. Yeah, it's not just cancer, yo. But they always think, cancer. I have no cancer, even though I smoke 100 sticks or whatever a day. Appendix can have cancer. Yes, appendix can have cancer. I had a case of that. Any part of the body can have cancer. There is a cancer where in the skin that happens. We call this what's the name of that? Oh my god, what is the name of that cancer again? Marjolin's ulcer. Marjolin's ulcer, Marjolin's. Okay, yeah, Marjolin's ulcer. Okay, Marjolin's ulcer. Let me type it down. Marjolin's ulcer. This is a type of cancer of the skin that presents 20 years after getting burned on that area. Let's say you accidentally burned yourself from something. Let's say you got a scald burn. You spilled hot water on your arm. You got burned. You got a 2nd-degree burn here, or let's say you got burned. 20 years later, you start noticing some ulcerations on that area. That's called a Marjolin's ulcer. That is cancer. It's a type of squamous cell carcinoma, or a squamous cell cancer of the skin. It is very typical, like after a burn. It's called Marjolin's ulcer. So that's see how what you call this, atypical it is as a lesion for it to be cancer. You would think cancer is a tumor, a lump on something, but this one is basically a burn on your skin, and it just evolved into cancer 20 years later. So that's why when we have a patient that comes in, hey, I have this thing on my skin, I have ulcerations, and they won't go away, and it's getting bigger. And we look at it, and we say, what happened? When did it start? And then they would say, oh, it only started like a few months ago, or like 2 months ago, and it just won't stop healing. Probably the first few treatments for it will be like wound cleaning or ointments. But if it's persistent, you start wondering, why the hell is this persistent? Then you start asking, then you start wondering, have you ever gotten burned in that area? And they'll say, oh yeah, I did, but that was such a long time ago, like 20 to 30 years ago. I'm like, yeah, there we go. It's a Marjolin's ulcer. That is cancer. It doesn't look like a tumor, but it just presents as an ulcer. It's cancer. Are they screwed if they get that? Not really, because it's treatable. Like, you have to remove that area though. You have to treat it like any other skin cancer. You have to remove the area and then treat any lymph nodes that are enlarged. Doc, has anyone asked if cancer is genetic, you will get it no matter what age? At X age. If the cancer is genetic, like for example breast, where you have a specific tumor marker, positive tumor marker, there's a very the common ones are BRCA1 and BRCA2. If you have that, then you have a very high chance of you have like a really super high chance of getting breast cancer. Case in point, Angelina Jolie. I forget which BRCA she had. But she was positive for it. And because she was positive for it, she decided to have both her breasts removed before she even got the cancer. Right? She had her breasts removed and then had implants. Or, I don't know if she had implants or if she had like grafting, autografts. Yeah, it was a long time ago. But the reason why she had her breast removed was because she tested positive for those cancer genes. If you have specific genes for a specific cancer, then yes, you're gonna have the cancer much higher. You have the chance of getting that cancer much higher than the usual. But if you have, like, let's say someone in your family, like your father or your mother had cancer, you have a chance of getting it too, because it runs in the family. The thing is, when you do like extra testing and identify the specific gene for it, that's expensive. That is expensive, bro. Okay. Oh, it is 3:39. I've been yapping about cancer for an hour 30 minutes. Okay. Any questions, guys? I hope you guys learned a lot from this one. This medical education is much more informal than my previous ones because I had a PowerPoint presentation in my previous medical education streams, but this topic specifically is very complex. That's why I can't just have a PowerPoint presentation for it. It's gonna take really long. It's like gotcha. Stream idea, horror movie, injury and death analysis. You know what? I am going to do something like that. Maybe I can do, I could probably do Final Destination movies. I have not watched Final Destination 2 onwards. I've only seen the first one, but I don't remember much about it. And then I watched this recent one, Bloodlines, which is the recent one is actually just really weird to me. The MRI thing was just so weird to me. The MRI, I don't know if you guys watched it, but is that even like freaking spoilable? Well, the MRI thing, I don't know if that's even a spoiler or what. But just there is an MRI. And that is freaking weird. That was weird to me. I'm like, the thing about Final Destination when I watched them is just so weird how they die. Oh wait, was this Dia Crossery? Thank you for the sub. Welcome to the stream. No, it's just that they made the human... It's like Mortal Kombat. They made the human body so brittle and fragile and squishy. It is so weird. Reacting to Mortal Kombat. I did that already though. I have a stream of that. I did that a few months ago. Main takeaway is cancer is a headache to diagnose. Yes, okay. The main takeaway from this, okay. If you're feeling something, like let's say you are having symptoms. You're having certain symptoms. Take into consideration your age, how long you've had them, and all that. Do you have a lump? In the first place, if you do feel a lump, you should be seeing your doctor. You should be seeing your doctor, not consulting ChatGPT or consulting Google. You can probably consult Google and ChatGPT to have a little idea of what's going on, but do not consider like the worst of it all until you've seen your doctor, okay? Because you're just gonna get anxious. Like a simple headache, and you search it up, it'll tell you have brain cancer and you're gonna die in like a few months or something. No, it's not that simple. a simple headache can be anything. It can be a migraine. It can be a side effect of your hypertension. It can be a stroke. Hopefully it's not a stroke, okay? That's bad. But you know, it can be anything. It can be actually, headache can also be dehydration. Okay. I had a lump on my back for like years now, and the doctor hasn't even seen my back and said nothing. If your doctor said nothing about the lump on your back, it's probably not cancerous. It's probably benign. Maybe it's a lump of fat in your back, and that's possible. You know, lumps in the back, it could be a lipoma. You just leave it there. But if it's bothering you, you can have it removed. If it's like bothering you, like when you lie down and you feel it, you feel this little lump poking you, you can have it removed. Question, sorry, can eating moldy food cause cancer? No, it's just gonna give you a stomachache, depending on what kind of mold it is. Speaking of mold, I have eaten moldy pastillas before and I'm still alive, okay? I didn't even know the pastillas was moldy. I tasted, you know, moldy pastillas taste so bitter and gross. It was like one of the nastiest things I've ever eaten. It was like the pastillas was still white, man. But then when I looked at it, there was like a little green spot on it, and I'm like, oh my god, there is mold, and I tasted it, it's gross. It's disgusting, guys. Do not even try moldy pastillas. It tastes nasty. It is like, it's bitter. Full of white. Actually, the moldy pastilla was green. It was green. It was green. Okay. So anyway, yeah. If you, okay, let's say, takeaway. Also, if you have a relative that's sick, let's say coughing all the time, coughing out blood, okay, coughing out blood. Remember that it can be anything. It can be TB, it can be just pneumonia. It's not always cancer. The only time you can truly diagnose cancer is if they have a checkup, they have a biopsy, and they have the proper diagnostics done. Okay? That's why you can't blame, you know, you can't say, may cancer to! Umuubo ng dugo, may cancer siya sa baga. Without any proof of it, okay? You can't convince your doctor na she's coughing up blood! Umuubo ng dugo! Cancer yan! You won't be able to convince your doctor until they do the necessary tests. You can't just say that's cancer, because it can be anything. Okay? I think, there are other cancers that we didn't cover, like lymphoma. Lymphoma is like cancer of the lymph nodes. So that one is actually pretty complex too. But they basically present with enlarged lymph nodes everywhere, like on the neck, on the armpits, on the abdomen, on the thighs, or yung mga singit nila, in the groin area. That one is non-surgical. That was chemotherapy. Leukemia. Okay, leukemia is cancer of the blood. Okay. That one is non-surgical. That one is treated by chemotherapy. And that one, you need a blood test. You need blood smears for those. So, that's why leukemia... I think leukemia is actually pretty difficult to find... signs and symptoms, because I think the signs and symptoms of leukemia are very generic, just like it can look like any disease, like weakness, weight loss, you know, all that stuff, pallor, being pale, which can be symptom for other diseases. That's why the only time you can actually diagnose that leukemia is when you get tested or blood tests, and they notice the trend on your blood count. It's not easy. Okay? Speaking of cancers, I know a few Filipino VTubers that died from cancer. I mean, I don't know them personally, but I have interacted with them previously. And they died of cancer. I think one of them is she's an ube VTuber. Wait. Ang pangalan nun? I forgot. Ube. I forgot, but she was an ube VTuber. I forgot her name. Oh no. Ube VTuber. I forgot her. It's not Ubebe. Hindi si Ubebe Chan, ah. It's a different Ube VTuber. Iba si Ubebe. But she was an Ube. Oh, okay, here we go. Yume Oborizuki. Oborizuki Yume. Her. She was an Ube VTuber. She actually consulted me. When she was sick, she actually messaged me asking about her symptoms. She actually messaged me before she died. Well, not really before, like immediately before she died, but she consulted me when she was having checkups for it, and I advised her to. She was talking about nose bleeding or something like that. And I told her to have that checked, because if that's persistent, you might need to have that checked. And it's a good thing she had that checked, because apparently she had cancer there. She had cancer somewhere in her nasopharyngeal area. And yeah, I really remember that. It was really sad. It was really sad. If I remember correctly, Rion was also affected by this because he interacted with her a lot. I think this was the time when she and he were like hosting an auction in this con before. I don't remember which con. I don't know if it was a FanFest con or a Cosplay PH con. But they were together hosting an auction, so he had a lot of interactions with her. So when he heard about what happened to her, he was pretty devastated and kinda in shock, because he was like, I was just talking to her like a few weeks ago. What? And it, you know. Is cancer of the lymph nodes Hodgkin's lymphoma? Yes, that's a cancer. Lymphoma is a cancer of the lymph nodes. There was also another one who died of cancer, a Filipino VTuber. It was, I think it was Itlo Girl. Itlo Girl yun, diba? I think her name was Itlo Girl. Was it her? Itlo Girl? I don't know if it's... I mean, let me confirm first. Baka naman... Yeah, it was Itlo Girl. I think she had leukemia. I think she had leukemia, I don't know. I think it's leukemia. She would always post on Twitter. She would always post on Twitter about being admitted and something about bone marrow. So I'm like, oh my god, is this a leukemia or is this a bone marrow kind of cancer? I don't know what type of cancer she has, but I know she had cancer. She died too in I think it was 2021 when she died. Do you know about Alicia's situation? Alicia? Who's Alicia? Sarcoma. Oh, it was sarcoma. Oh. She had sarcoma? Or wait, who had sarcoma? Was it little girl who had sarcoma, or oh, it was leukemia, or was it leukemia, or both? Holy shit! Was it leukemia or sarcoma? I think it was leukemia. Sarcoma can be bone or even soft tissue. Sarcoma is on bone and soft tissue. Oh wait, so it was sarcoma? She had... Oh. Bone marrow sarcoma, that's what she had? So that's a myeloid sarcoma. That's rare. What? Wait, that is rare. Not many people get that type of sarcoma, yo. Holy shit. That is rare. If it's bone marrow, if it's a myeloid sarcoma or bone marrow sarcoma, that is rare. Holy crap. Oh man. I thought it was leukemia. Man. Okay. I'm getting depressed now. I'm getting sad now. Let's not talk about these VTubers anymore. I'm getting kind of sad now, man. But you know, in general, it is sad when someone young gets a type of cancer. It doesn't matter what kind of cancer it is, but it's sad when a young person gets cancer. Because cancer is something you would expect on an older person and not really someone like in their 20s or even younger. Yeah. So, yeah. Anyway, I hope you guys learned a lot. I'm sorry that this was not that formal like my usual, because diagnosing cancer is not just a simple algorithm. You have to be able to if you are suspecting in any way something serious in a relative or on yourself, like a symptom you've been having, it's better to consult a physician about it and get tested, because cancer is something that you can't, diagnose or just point out very easily. It takes a lot more than just simple signs and symptoms. You have to look at the patient. Again, you have to look at the patient as a whole. Like from gender to age to what they have been doing with their lifestyle. How long has it been since they had the symptoms? And it also includes a physical examination. Okay. Otsupon Scuffter, you're the best. Thank you. Still very educational. Thank you so much. Yes. You're welcome. I hope you guys learned a lot. And yeah. Okay, my next stream will be tomorrow. It will be at nighttime, 9 p.m. Philippine time or 8 a.m. Central. I'll be playing Tekken. I haven't played Tekken for a week, so probably when I play, I am very rusty. Especially that I think there was a patch recently, so there was some changes with Xiaoyu a little bit. And then Saturday is Tekken with viewers, which I wasn't able to do last time. So yeah. And then Sunday is more Doom Dark Ages on Twitch. Okay. So yeah, Otsupon guys, and thank you for coming to my stream. I'll see you guys tomorrow on Twitch. I hope you guys learned a lot. Walang quiz today, guys. Walang quiz. you guys suffered enough from the last quiz anyway, so. At sa pan, guys. Goodbye. See you next time.